Early morning you get up, rightly shave, nightly dress, and you'll sit and read the paper. Observe no problem. One fine morning she noticed he is not shaving daily, he starts forgetting. He is not putting his shirt properly. He is not wearing the slippers properly. He started going to the street playing with the children. So this is not the habit of my husband. There's something wrong. Please underline the word something wrong. Any elderly people, you notice it is not like that. Let's say something wrong, immediately bring him to geriatrician. We can identify. Then he came to my clinic. I diagnosed. I took a scan. There is a vascular dementia. It completely was all right. The only moral of my speech is early diagnosed dementia is only by his changing personal activities. You can easily find out. So first, Parkinson's disease. Don't get worried about the different type of disease, but these are going to happen in the future, just I am telling you, so that you can take preventive aspects. Third is about the falls. It looks very simple. Falls எல்லாம் ஒரு டாப்பிக்கா அது டாக்டர் டைம் வேஸ்ட் பண்ணுற நினைக்கல, பட் இட் இஸ் வெரி வெரி இம்பார்ட்டன்ட் டாபிக் இன் ஜீரியாட்ரிக் மெடிசன். ஸோ ஃபால்ஸ் வில் அக்கர் வித்தவுட் தேர் intention, without any intent, they tend to fall. So as we grow older, there is a balance center in the cerebellum. That cerebellum is connected with all the afferent neurons from the ear, from the eye, from the cervix, from the joints. All the afferent neurons goes right to center. As we get older and older, without any disease, there is a degeneration of the reflex system. We lose their balance. We tend to fall. So there is an intrinsic factor, there is an extrinsic factor. Intrinsic factor to diseases, suppose blindness, hard of hearing, or cervical spondylosis, or severe peripheral neuropathy, or arthritis. There are the reflexes are very poor, they tend to fall. But the extrinsic factor is very important. Thank you, sir. I won't disturb you often. I am taking not because I am thirsty. I am taking because your kindness.
Yes. I am worried because
No. I am perfectly all right. So that is intrinsic factor due to disease in your body. Extrinsic factor is what is outside. When you say the staircase very very more than 9 inches, the water is slippery. Most of the falls occur in the bathroom and in the kitchen. You go to the bathroom, the wet floor, all the railings are there. So staircase are high. The kitchen, when you go, they have to take up these things from the higher side. Then they rotate and tend to fall. So fall is very, very common. Just they lose their balance. The extrinsic factor, intrinsic factor. Because of fall, you have a fall in a child, so just fell down, look at difference, nobody there, just get up and run away. When somebody there, you start crying. But the elderly people, fall is single fall. It's very difficult to get up. Sometimes they might not have any injury at all. They totally recover in the fall. But because the fear of fall, next you don't want to move around because it restricts. I may fall again. That may endanger my life. So they will totally depressed. They will go to bed fast. Then they will go for dementia, depression. So single fall will make them unhappy. You may not have any injury. So, but you have injury, commonly see a Colles fracture here, commonly see a hitch fracture, commonly see a, when they will lose their lives, simply fall. So, there is one quotation, I don't know how many will believe it. First fall is beginning of age. Whether you are 20 or 30 or 40, you have one fall, that means you are entering into the old age. First fall is beginning of old age, second fall is the end of that. When you have second fall, that's almost come to the end of your life. So that shows the importance of fall. That is very, very important. Many people see no disease at all. When they walk, they tend to fall. For them, there is no medicine for that. Only physical therapy. Physiotherapists can do wonders. There is a balance training exercise. There is a special exercise called a balance training exercise. Don't take any medicine. Ask a qualified physiotherapist. They will teach you. Completely you get the revived balance. So falls is one of the important common problem in old age that can be easily identified, they can be easily treated. The next is urinary problems. Most of the elderly men, they know what is a urinary problem because of prostate. At the age of 50, 60, they tend to pass urine very frequently, more at night, nocturia, polyuria. precipitancy, so many things are there. And ladies also, they have a urinary problem, urinary incontinence, what you call as stress incontinence. They are quite all right, no disease. When they cough, when they sneeze, this spurt of urine will come out. That is what you call as stress incontinence. So there is incontinence for the elderly woman, there is a urinary frequency for the elderly male. It is easily, nowadays, previously, the ladies, they have never come to the doctor feeling shy to tell the doctor that they have a urinary incontinence. So because of that, they avoid to go out for the conference, meeting or marriage things. They would get isolated. They cannot go by a car or by a train because of the incontinence. They have to go only by car. So nowadays we got a wonderful treatment, so excellent treatment available for the urinary problem. Gents, we have a prostate. By medicine alone we can control. Even not possible, they can do the surgery, TU or CP surgery. Even you can also give laser treatment. For ladies, for the urinary problem, we can get the tablets available. But now they are identifying an exercise, that is pelvic floor exercise. For people who have the urinary problem, pelvic floor exercise. That means just hold the, as if you are going, you urgent, you want pause, you will control the body. Just hold the pelvic floor tightly for 10 to 20 times in the morning and evening. Devil, you get rid of the problem. With the exercise alone, we can treat the urinary problems. I don't want to tell more of a disease, then you get depressed. Why should you take this geriatrician to tell all the negative points? The last one is telling you the cancer. Cancer common in all the ages, more so in old age. When many people think we won't develop cancer, you can get it any time. Suddenly it will come out because it is very silent. So you must know how to identify cancer in the very early stages. For ladies, everybody you know already about the breast cancer, about the cervical cancer is very, very common. No, because of the education, the breast cancer incidence is very much reduced now. Awareness there, self identification is there. They can able to find it early. They can do treatment. Breast cancer getting reduced, and we are getting cervical cancer only more and more. And you can take the pap smear and you can identify the treatment. But how the atypical presentation, that geriatric medicine is mainly popular because of the atypical presentation. For example, tell you, suppose a person gets pneumonia or chest infection, normal individual, you develop high fever and he cough, phlegm, breathing problem, sometimes you get blood also. That is typical presentation of pneumonia in the younger people. The same pneumonia occurs at the age of 70, you won't have high fever, you won't have high fever, very little bit of cough, but you totally confused. That's the presentation of pneumonia in elderly people, mental confusion is the presentation. So, but the doctor who knows about the discipline, we take X-ray, we will give high antibiotic, they will be all right. A person who doesn't know about the 8%, they give some additive, it will depress the respiratory center, they go over further coma and die. So that's taking that. In cancer, you would find out early stages. Suppose you have unexplained loss of weight. There is no obvious reason, but you are losing weight. That means something wrong. You may have cancer. Unexplained loss of weight. Unexplained fever. 2 weeks, 3 weeks, 4 weeks, continuous fever, low-grade fever. That means you are having a cancer. Or unexplained cough. With no reason, you are getting cough. Then getting a mole or, wart, mole, macham. If you have increasing signs, there is previous chance of getting a skin cancer. Like that, so many things are there. So you find out and you can get the treatment. Without I stop this point, I go to this other aspect that is most useful for you about how to have a healthy aging. And now I explain what are the problems, just few problems. You have taken the hundreds of problems there. So I will go for the healthy aging. Most important thing is, I told in the beginning, many diseases in old age are preventable and treatable, for which you must go for periodic health checkup. Even at age 50 and 60, just take it a point. No complaints. Go to the doctor, geriatrician or family physician. Take complete blood test, ECG, X-ray, abdomen scan, everything you take it, go to the doctor. This we can find out the disease without any symptoms. With that we can find out we have find out hypertension, diabetes, obesity, cholesterol, thyroid, very, very silent. By doing this, if you have a silent disease, we can give the early treatment. Within 1 or 2 tablets, you will be all right. So first year, it may take out 5,000 rupees. Second year or third year, You did not go for complete checkup. When the ECG is normal, scan normal, don't do that. What is blood test is abnormal, only go for that test alone, it costs about few hundreds only. So by doing periodic health checkup, in old age, we can detect many silent diseases. Silent is meat, hypertension, diabetes, thyroid, and osteoporosis like that. It's very, very important. Because suppose you have early diabetes, early hypertension, no medicine needed. Just go for regular eggs, just have diet restriction, you will be all right. So you have osteoporosis, just a calcium-rich food and go for walk in the sunlight, you get vitamin D. So the early diagnosis possible only with periodic health check. But many people ignore, I didn't have any symptoms. Why do I go to the doctor to spend unnecessary money? That is wrong ideas. Because in my case, in my clinic case, patient comes, sir, I have joint pain, sir. Okay. Then I routinely check the BP. BP is 160, 100. No, sir, I don't have any symptoms, sir. No, that is wrong. That is geriatric medicine. No symptoms, but still you have a disease. Take the treatment. He won't still go to some other doctor. The doctor knows the psychology. He said, oh, you are 40 or 80. He will be very happy. The third day you end up with a stroke. So please go for regular checkup. Don't wait for the symptoms once in a year or once in 2 years. That's the first step. Second step is exercise. As Rajan told you, exercise is the best tonic in old age because no side effects. You not spend any money, but you get a lot of benefit doing exercise. You reduce your weight, you reduce your BP, reduce your sugar, reduce your cholesterol. Your bones are getting strengthened. It prevents constipation, induce sound sleep. See, so many benefits without any side effect, without spending any money. It is not the best tonic in old age. So please, if you are going tomorrow on, go for a walk for at least 45 minutes to 1 hour or 3 to 5 kilos. Just simple walking will do. Don't go for jogging, something. Simple walking. Go for it. When you go out for walking, please take your ID card because anytime you have fall, anytime you happen, anything you get hacked, we don't know. Have a ID card that have your name, address, doctor's name and address. So exercise is the most important. One lady said, sir, I have severe OA knees. How can I do any exercise? I said, for you, there is a upper body exercise. Sit in a chair, stretch your hands, then do the upper body exercise, then do the stretching. That is enough. If you do 10 minutes,